My topic for today's discussion is regarding fluid and water management in a patient of heart failure. This topic is extremely relevant and important because a lot of people do not understand the concept. They keep on taking a lot of water and then they start to feel dyspneic, start to feel breathless. They are not able to manage their heart failure appropriately. A lot of times it is the mistake of the doctors also, because doctors also fail to advise the patients regarding the fluid restriction. People continue to take medicines to increase the water, but they fail to reduce the fluid intake, which is very important in heart failure management of the patients. This concept we will be discussing today, and what are the important aspects of this management, what are the tips to reduce fluid intake. A lot of people have a lot of queries regarding what to do in summer months, what to do for the medicines. A lot of times when fluid intake is compromised in a patient, these are the questions which we will be discussing in this topic today. This topic is going to be very interesting and clinically useful for you, so I would recommend you to see the video till the end. The people who are new to my channel, I would request them to subscribe to my channel, as this would give us a lot of inspiration and motivation to continue the good work. Now, the topic for today's discussion is regarding volume or fluid management in heart failure patients. Basically, if a normal or a routine person with a normal heart pump function, if he takes in extra water, the excessive water is excreted in the urine, and the patient has the capacity to produce any amount of urine. Even if you take 5 to 10 liters of water in a day, then also the body can produce 5 to 10 liters of excessive urine, and the extra volume can be dissipated and the body can get rid of them easily. But in a case of heart failure, because the pump function of the heart is compromised, the kidney perfusion is also compromised, and the body loses this capability to excrete the excessive amount of urine, or excessive amount of water production from the urine is usually compromised. If at all the person takes his extra water, the water starts to get filled in the lungs, and then the patient starts to feel breathless and dyspneic, and is not able to do his routine day-to-day activities. To reduce this excessive water, doctors tend to prescribe volume reducing medicines, or diuretic medicines as they are called, to get the excessive water out of the kidneys and to reduce the volume level of the body. But if at all the doctor has not advised, or the patient does not follow fluid restriction and he continues to drink more and more water, then the amount of medicines required to get the volume excreted will be very high. The side effects of these medicines will be high, and unnecessarily the patient will be advised or would be forced to take all these medicines lifelong, because he will keep on drinking 3 to 4 liters of water, and to remove this 3 to 4 liters, around 3 to 4 medicines will be required. So this is detrimental for the long-term interest of the patient. One thing which is very important, that the fluid does not just mean only water. It includes any drink, whether it is tea, coffee, juice, alcohol, any fruits containing water, any desserts which the patient is taking, any soups, any ice creams, any other liquid nutrition which the patient is taking. Everything will be counted in this fluid, and the patient with a significant amount of heart failure has to keep the fluid restricted to around 1 liter or maximum to 1.5 liters per day, which includes all of these fluids and not just water. Some people tend to feel that when we advise them fluid restriction, we advise them water restriction. They will not take water, but they will start taking more of milk, more of juices, more of other desserts, other fluid containing fruits, and at the end of the day, the total fluid consumption will be the same, or it will be rather sometimes even more than what is expected from the patient. So fluid restriction has to include all forms of fluid which the patient is taking, and it's not just restricted to water. Secondly, if at all the patient continues to take excessive amount of water, or the body does not excrete even this amount of water also, then we have to prescribe diuretics. But diuretics medicine do cause a lot of side effects, and they harmfully affect the heart and the kidney, so they ideally should be prescribed for the shortest possible duration as is required for the patient. Maintaining this fluid restriction is slightly difficult, but this has to be absolutely done in patients where the pump function is less than 30%. If the pump function is more than 30-35%, or if the pump function is more than 40%, usually fluid restriction is not required. In a pump function where the patient is not having breathlessness, and the pump function or the LV ejection fraction is more than 40%, then the patient need not follow the fluid restriction. But if it is less than 40% and the patient is breathless, then we keep on restricting the fluid depending on the requirement of the body. If the pump function is very low, it is around 10 to 15%, then the fluid has to be restricted even below 1 liters to around 600 to 700 milliliters of water and all the fluids total in one day. If the pump function is around 30-35%, then the fluid restriction can be slightly relaxed, and the patient can be advised to take around 1 liter to 1.5 liters of fluid every day. The patient should keep in mind that a lot of whatever fruits or whatever juices the patient is taking, everything will contribute to the fluid intake, whether it is water, milk, juice, tea, coffee, soup, broth, puddings, yogurt, that is dahi, any jello or gelatin based candies, ice cubes if the patient is taking ice creams or popsicles or frozen desserts, everything contributes to all this fluid intake. A lot of fruits also contain a lot of water, especially the watermelon fruit contains a lot of water. So everything of this should be restricted, because if at all you keep on taking more of these things, then the water restriction alone will not be sufficient for the ideally you should gradually reduce the fluid which you are taking. Sometimes what happens that we suddenly restrict the fluid of the patient, that the patient can have sudden drop of blood pressure and the patient might start feeling dizziness or hypotensive. Usually the fluid restriction should be restricted gradually. Initially the patient who is taking around 2.5 liters or 3 liters of fluid, he should be advised to keep restricted maybe to 2.5 liters initially, then 2 liters, then 1.5 liters, and over a period of time the body should be given some amount of time to adjust to the decreased volume intake as well. If the patient is developing swelling of the legs, this is a symptom of increased volume intake of the body or increased fluid retention of the body. In such cases, the patient should be advised to measure the body weight of the patient every day. If at all the body weight is increasing without any reason over a period of few days, then it is very likely that the patient is retaining excessive fluid and fluid restriction has to be advised. In a patient who is having severe swelling of the legs, it is advisable that the volume restriction or the weight reduction should be done by 1 kg per day with the use of diuretics, and the patient should monitor the body weight of the patient every day to ensure that he is not retaining more and more fluids. For example, if the body weight is around 55 kg and it is suddenly going to 58 or 59 kgs and the patient's fat content has not increased, then it is very likely that the patient is going into heart failure and he has to take in more of diuretics to reduce the fluid intake and to get the body weight back to normal. He has to maintain the dry body weight of the patient has to be maintained. The body weight should not keep on increasing, and every day monitoring the body weight will help the patient understand whether the body is retaining excessive volume and he has to take diuretics or not. Now we'll give you some tips how the patient can restrict the fluid intake, because sometimes it becomes very difficult for the patient to restrict the fluids. So one thing is very important, that as far as possible you should use small glasses of water. If at all you are drinking water, then you should not take a full glass of water, because a full glass of water will mean around 300 to 400 ml, and if at all you take 3 to 4 glasses, that will be more than 1 liter. To always use small glasses which will be around 50 ml to 100 ml, and even if you fully drink that water or fully finish the glass of water, then also the fluid intake will not be much. This is similar to the fact which we advise to obese patients that they should use small plates. It is usually the tendency of the person to try to finish the entire food material which is available in the plate. So similar thing is advised to all the obese patients also, that they should take a small plate and some amount of food should be kept in the plate, so that even if he finishes one full plate of food, he doesn't overeat. Similarly for water also, if you are using one big glass of water, then your tendency to finish the glass will cause you to take in more fluid. If you are using a small glass of 50 to 100 ml, then even if you finish the glass fully, then also you will not drink excessive amount of water. Next important tip is to reduce the salt intake, because excessive amount of salt which we take, that also causes retention of the fluid and retention of the water inside the body. So at any point of time the patient should not take extra salt, and this salt includes whatever salt is added to the vegetables and the cooking also. Sometimes people tend to feel that the salt intake is restricted only to the table salt or extra salt which they are using with the food, but that is also inclusive of the salt which you are putting into the vegetables. That also has to be restricted. Then if at all the patient is feeling thirsty, then he can use fruit cubes or frozen candy or ice cubes or frozen fruit. This also will, if at all the patient sucks, then that can be used to wet the mouth, and usually the patient will not feel thirsty if at all he is feeling excessive thirst. If the patient has to take multiple medicines, that is a very important problem which the patient asks, that I have been asked to take 10 medicines, but 10 medicines I cannot take it with one glass of water, or 10 if at all I am using one glass for every medicine also, then also it becomes excessive. So for such patients we advise that you can club the medicines together, and the morning or the evening medicines you can take it at separate times, or you can take the entire medicines in one go, and you can take over 4 to 5 medicines in one go and swallow it with one complete glass of water, rather than for every medicine, if you are taking one glass of water, then your entire fluid intake will be more than 1 liter just to take the medicines also. So if you have to take up maybe 8 to 10 medicines in one day, then it is advisable to take all the medicine at the same time and use 1 full glass of water to swallow the entire group of medicines. Or you can use the medicine as far as possible only to get the medicine into the esophagus, but do not try to drink a huge amount of water whenever you are trying to swallow the pills. One big problem with this is that sometimes if the medicine is slightly irritant, then if it sticks to the food pipe, then it can cause ulcers over there. So ideally it is advised that whenever you are swallowing medicines, at least half a glass of water should be taken. Just do not, if you are just sipping 1 or 2 gulps of water, then the water may not be sufficient to push the medicine into the stomach. So while swallowing medicines, at least maybe around 100 ml of fluid is advisable for the patient to take, so that he does not develop food pipe related medicine related ulcers in the food pipe. Patients can use chewing gums also. This can be used to wet the mouth whenever the patient is feeling excessive thirsty. Whenever you are drinking water, then you should just sip water rather than gulping water. Rather than just drinking the entire water in one gulp, you can just sip few milliliters of water every time. So this will help you quench your thirst, and this will also avoid the excessive fluid intake at one point of time in one go whenever you are trying to drink water to quench your thirst. Then you can space out the fluid intake. If at all you are trying, if you want to drink water and you are feeling thirsty, also try to space out the fluid intake, that if you are taking some milk, you can take it at one point of time, then you are taking some juice, then you can take it at another point of time. So if you are spacing the juice or the milk or the whatever water you are taking at multiple points of time, then overall during the entire course of day you will not feel thirsty, and you can control your fluid intake, and you can manage within 1 liter of fluid. So spacing of fluid is similar to what we advise for alcoholic patients and obese patients also, that if you are increasing the space between the fluid intake, then the overall fluid intake for the entire day will drop. You should avoid excessive sugar intake also, because if you take excessive sugar, then that will also create an osmotic pressure and it will make you more thirsty. If you take excessive sugar containing fluids, then if at all that is excreted into the urine, that will also cause you more amount of thirst and more amount of water intake. Your body will feel the requirement to take in more water. So sugar intake restriction is also advised for patients who are advised to reduce the fluid intake. People are advised to take one large bottle of water, and that bottle may be around 1 liter or 750 ml or whatever amount they are taking, and every time when they are drinking water, they should use that same bottle to drink water, so that you can have a calculation of the entire amount of fluid which you have taken for since the morning. Because sometimes what happens that at the evening you tend to forget, especially in the elderly patients, you tend to forget how much amount of fluid you have taken in the morning, and even if you have taken 2-3 glasses of water, you tend to forget, and it sometimes become difficult to manage the fluid intake. So you keep one bottle reserved for yourself, and that bottle only should be used by the patient, and the water from the bottle should be used to swallow the medicines also, and for other times, and while having food also, to swallow the food also. The same water can be used from one single bottle. So that will help you to understand how much excessive fluid you are taking during the entire course of the day. Sometimes people can maintain a food diary also, because like food diary, you can have a fluid diary also. If that will help you to just keep a charting of how much amount of fluid you are taking for the entire day. And if you are taking excessive amount of fluid for one day, then you can have a calculation if you are entering everything into the diary. You can sometimes use a refreshing mouthwash also if you are feeling dry multiple points of time, because if at all people have some oral irritation or oral ulcers or oral infection also, these people also tend to feel more thirsty. So you can have a refreshing mouthwash or some oral antiseptics if at all you are having some oral infections, and that will help you to reduce the total fluid intake which you have to just taken to make your mouth feel a little bit wet. We have advised you to take the most important tips which we have advised you to use smaller cups and glasses. Keep one measured bottle and drink fluid from the same bottle. Take all the pills together, because excessive amount of water which is usually required to swallow the medicines can be dangerous. Sip your fluid slowly. Do not gulp your food. Do not take in a large amount of fluid in one gulp. Some people can use a reusable water bottle and measure, keep the fluid amount of the daily fluid which they are taking, that they can use to measure to control the total amount of fluid which you are taking. People can swallow the fluid with some other juices also, and swallow the pills with some juices also, and swallow the medicines with sometimes with yogurt and porridge also. Yogurt usually contains a lesser amount of fluid, and that can be used to sometimes keep your mouth wet and swallow the medicines. You can use milk also, but milk also will be counted as water also. Sometimes you can, if you have multiple medicines you have to swallow, and if you want to drink juices also, if you want to take milk also, then you can use them to swallow the medicines also, but because that will reduce the total amount of fluid which you have to take in for the entire day. Whenever you are rinsing your mouth, you have to rinse your mouth, but do not swallow the water. Some people have a tendency that whenever they are rinsing or gargling their mouth, they usually swallow the water which they are keeping in their mouth. That water has to be spitted out and should not be swallowed. Even while brushing your teeth also, you have to keep that in mind, that the water which you are taking to get the lather out of the mouth, that you have to not to swallow and use spit it out as after you have finished your brushing. Use a mouthwash regularly, because that will reduce the foul odor from your mouth and the infections of your mouth which can occur if you are taking less amount of water. Use a good quality mouthwash, but that should not contain alcohol. That they cannot control the fluid intake, then they should discuss the thing with the doctor and how much amount of fluid they are permitted to take, that they can manage. Even if patient is having a severe heart failure and still he is feeling breathless, even if he is taking very less amount of fluid, then he can discuss it with the doctor. And sometimes the low dose diuretics or urine increasing medicines have to be used in such patients, because sometimes despite howsoever the patient tries, the fluid intake cannot be reduced to a very significant extent. And sometimes even if the fluid intake is reduced, then too the patient tends to feel breathless because the heart is very weak and the capacity is very low. Then you have to add the diuretics for a short duration of time to increase the urine output for the patient. Avoid drinking alcohol, avoid drinking taking sweet foods, because all these things will make your mouth very thirsty and you will feel very dry, and that will force you to take in more amount of fluids. Always use sugar free gums, because the more the sugar is present in chewing gums, that will also make your mouth very dry, and that will make you feel very thirsty. If at all you are developing oral ulcers or lip cracks, then you can use a lip balm. One thing is very important, that you should avoid overheating of your homes. If at all you are living in a very warm environment or a very hot place, then if the room temperature is very high, then you will feel more thirsty because more amount of sweat will occur. So in such cases you should avoid being in a very hot and humid condition for a long period of time, and you should keep the room temperature at a very suitable temperature levels. Do not keep the room very cold also, do not keep the room very hot also, because that will increase your fluid intake. You can use a humidifier in the room to control the humidity of the room, because sometimes what happens that if the room is very dry, then also the sweat evaporation will be very will increase and your fluid requirement will increase. In rooms where they are very high humidity also, that will also make you uncomfortable. So you can use a humidifier to keep the humidity levels of the fluid in control. These were all the tips which we wanted to discuss too, which were very important for heart failure patients, because a lot of times the doctor do advise the patient to restrict the fluids, but in our routine busy practice in our OPDs becomes very difficult to give the patient tips and tricks, and it becomes very difficult also to advise to the patient each and everything which the patient has to be kept in mind while we are advising fluid restriction. Because so many times I have seen our Indian patients that the patient is on diuretic, the patient is very breathless, but he'll still keep on taking 3 to 4 liters of fluid, because some people or some practitioner has told them that they should drink excessive water to purify their bodies. This is especially true in our Indian scenario, because our Indian people tend to feel that the more water we take, that is good for the health. Of course, in sudden GI problems and kidney related problems, more water intake is good for the patient, but in heart related patient, that should be taken with the patient should be very cautious. If at all the patient is having some constipation related problem or renal stone related problem or some other problem where excessive fluid is advisable for the patient, in such patient you should discuss with both your cardiologist and your nephrologist or with your gastroenterologist that what is the perfect balance of fluid which the patient should take in order to not allow the heart to worsen also, and in order to circumvent the other problems also, because if the body is continuously dehydrated, the kidney stones and kidney related problems and the constipation related problems of the gut might also increase. So if at all multiple diseases are there, then you have to discuss with all your doctors about the extra requirement of fluid which the body has to be maintained, and what extra can be done to decrease the problem of constipation and stone related problems and kidney related problems. The purpose of this topic was to educate the people regarding the volume intake of the heart failure patients and what exactly the patient should do in order to manage the fluid intake of the body. Usually for this information, people tend to depend on their doctors and their friends and relatives. Doctors, because of time constraint, may or may not be able to deliver all the information to you, and the information which is obtained from friends and relatives may be partially correct, and following such principles might be sometimes detrimental for the patient because the condition of the patient might deteriorate rather than improving if we follow these tips and tricks. I wish to make the scientifically correct information easily available to you so that you do not need to run to several places to collect all this information. If at all you like the concept of my channel, I would request you to like my channel, to subscribe to my videos, and if you feel that the content is relevant and useful for your friends and relatives, I would request you to share the link of the videos to your friends. Or your clinical problems, you can discuss about them in our comment section and we will try to answer all your questions. In the end, I am Dr. Naveen Agrawal and I am signing off, thanking you a lot for the patient listening of the topic, and I hope that I have given you adequate amount of information which was sufficient regarding this topic. If you still have any questions and queries, feel free to ask, and the people who are new to my channel, I would request them to subscribe to my channel, as this would give us a lot of inspiration and motivation to continue the good work as we are doing now. Thank you.